Good afternoon and thank you for joining us. My name is Tina Tebow and I will be your moderator for today's briefing. Joining us today, the Honourable Ian Rankin, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina, and good afternoon, everyone. Today we are reporting 117 new cases of COVID. We do have some sad news today. We lost another life in Nova Scotia. A person in their 80s died in hospital earlier. So my condolences and my heartfelt wishes are with the family impacted by that loss. I am concerned about the number of patients being admitted to hospitals with COVID symptoms. We now have 95 people currently in hospital. That number took a jump in the past 48 hours. People are arriving to the hospital sicker and later into their symptoms, 9 to 10 days into their illness. They range in age from early 20s to people in their 90s. There's people in their 30s, 40s, 50s, 60s, and 70s in the hospital. These variants, as I said many times, do not discriminate in age groups. There are 17 patients in ICUs across the province, mostly in our central zone. 11 others are in intermediate care. And we have a number of patients who contracted the virus while in hospital. We now have more hospitalizations than we had in the first and second wave combined. Our system is under immense pressure. Our hospitals have been able to manage other illnesses and emergency cases, and we have a number of Nova Scotians without COVID who also need hospital care. I spoke with Brendan Carr, the CEO of the Nova Scotia Health Authority, and he can speak further to the plan that's in place later today. But you need to know that everyone is working tirelessly to keep our hospitals safe to protect everyone. We need you to do your part to protect them and each other. That means following the restrictions and the public health protocols, including wearing your mask. There was a protest planned for this weekend, a group of people who don't agree with wearing a mask or following restrictions. Our government went to court to seek an injunction, and that was granted today, preventing this group and any other from organizing, preventing, and participating in a gathering against the protocols. I am personally all for freedom of speech, but I will not allow the select few to jeopardize our ability to crush this third wave. People have a right to share their views, but while we're in a province-wide shutdown in the middle of a third wave, it is incumbent for all of us to protect each other by following public health protocols. If people don't think this virus is real and don't believe in science, look around and think again. And quickly on the vaccine front, pleased to see that we dropped the age yet again to 35 and up. We've done that less than a week from the last age change, and we're continuing to ramp up week over week. Now I'll turn it over to Dr. Strang.
Thank you, Premier, and good afternoon, everybody. My thoughts and prayers, too, are with the family mourning the death of a loved one today. This virus is relentless and serious. Our hospitalization numbers are concerning. People are getting very sick, sometimes right away, but sometimes days and days after finding out they have the virus. My thanks to the doctors, nurses, and all the other staff in hospitals caring for these patients. What you are doing matters, and we are all in your debt. To all Nova Scotians, I can't express how important it is to be vigilant and do everything we are asking you to do. It's the only way out. We owe it to the people fighting for their lives, their families, and to the staff working around the clock to care for them. Our case numbers are still in triple digits, not what we want or had hoped for. And workplaces continue to be a significant source of exposure and spread. There are over 90 workplace investigations underway right now. And I want to again urge employers, especially in the Halifax area, employees who can work from home should be. For workplaces that are open, it is critical that you have strict COVID protocols in place and that they are followed. Limiting spread in workplaces is critical if we are going to get this outbreak under control. And we continue to see virus activity in western, northern, and eastern zones of the province as well. This is not a Halifax-only issue. We need to all act like there's potential for virus in any of our communities, no matter where we live in the province. And there are a few communities with clusters of cases in the Sydney area, the Bridgewater area, and the Annapolis Valley from Middleton to Kentville. And we will be doing broad testing in these areas to determine if there's virus in those communities that we are not aware of. And Nova Scotia Health will share more information soon about testing options in these communities. Testing helps us identify and isolate positive cases and stops the spread. Regardless of what health zone you live in, what part of the province you live in, assume COVID is in your community. Follow the public health guidelines and go get tested, not just once, but on a regular basis. And if you have lots of contacts through work, you should get tested weekly. Now I want to talk about the vaccine rollout. These are challenging times, but the vaccine and Nova Scotians' clear commitment to getting vaccinated is our way out of this pandemic. At the end of yesterday, 45% of eligible Nova Scotians have had one or more doses of vaccine. We ask you to be patient and trust that our age-based approach continues to be the right way to go. It is the fastest, most efficient, and equitable way to get all Nova Scotians a first dose by the end of June. We are on track and even slightly ahead of schedule. Nova Scotia has one of the highest vaccination growth rates in the country. And today we have opened appointments to Nova Scotians aged 35 and older, and will continue to open up age groups over the next few weeks. We're also looking at whether we could deliver second doses faster than originally planned. Second dose appointments are automatically booked 105 days after the first dose appointment, but we may be able to move that timeline up and also allow more flexibility in the location of where you could get immunized. We still have lots of planning to do before we can say so for sure, and it will always be dependent on the steady, reliable supply of vaccine from the federal government. But we will have more to say on the second dose planning in the coming weeks. So far, Nova Scotians are leading by example in our vaccination. 96% of our 75 to 79-year-olds are vaccinated. 96%. They are the group to beat. We all need to match that 96%. So I hope every age group continues to step up, get their vaccine as soon as they can, and help us move closer to our goal. You need to remember that youth alone does not protect you from this virus. Young people need to get this vaccine too. To achieve our target of vaccinating at least 75% of the entire population, we need 85% of eligible Nova Scotians to get the vaccine. And I want to speak directly to those of you who received a first dose of Astrazeneca vaccine. With the news that Nova Scotia and many other provinces are pausing the use of Astrazeneca, I know that many of you are feeling confused, angry, or even scared. I understand that, and I apologize if we contributed to this. I want to explain our decision and hope that you will continue to trust our advice. First, I want to thank those who chose AstraZeneca to protect yourself, your family, and your fellow Nova Scotians. I want you to know that AstraZeneca vaccine is protecting you from COVID-19. Multiple studies have shown that it is effective at preventing serious illness and death. Our commitment is to get you a second dose. We'll know more in a few weeks about the National Advisory Committee on Immunization's recommendation around mixing vaccines, and we will have this information before our second dose rollout begins. We paused the use of this vaccine for 3 reasons. An observed increase in the rare blood clotting condition known as vaccine-induced immune thrombotic thrombocytopenia, or VIT, the availability of mRNA vaccines for the same age groups, and the actions of Nova Scotians who are canceling appointments or choosing to get one of the other vaccines. Decisions on the use of AstraZeneca in Nova Scotia have always considered the risks of the vaccine, the risks of exposure or severe illness from COVID, and the availability of other vaccines for specific age groups. We've also provided clear information so people can make their own informed decisions after considering the risks and benefits. And that is always a priority for anyone getting vaccinated with any vaccine product in Nova Scotia, informed consent. It's important that you know there have been no blood clot events in Nova Scotia. Side effects occur within 4 to 28 days of getting vaccinated, and then with AstraZeneca, and the known rate of VIT is around 150,000 now in the country. There's a full list of side effects that you need to watch for if you're still within that 28 days post-vaccination. And they're on our website at novascotia.ca/coronavirus/vaccine. Anyone who experiences any of these side effects after receiving the Astrazeneca vaccine should get medical attention right away. And so I'll leave you with 3 key points. You made a good decision by choosing to get vaccinated. You are protected from COVID-19 because the vaccine you got is effective, and you will get a second dose of an appropriate vaccine. I want to remind all Nova Scotians that for now, whether you are vaccinated or not, following the public health protocols is still necessary and incredibly important. The vaccine is our way forward, but it alone won't get us out of the outbreak situation we're in right now. Whether you've received 1 or both doses or are waiting for your first dose, you still have to be vigilant. Practice the public health protocols, stay close to home, get tested, stay home if you're sick, and shop only for essentials. And when you do get your vaccine, tell everyone you know. Encourage your fellow Nova Scotians who may be nervous or undecided to get vaccinated. Let's be part of the way forward together. I wish everybody an enjoyable and a hopefully sunny weekend.
Thanks, Dr. Strang. Just a reminder, we'll take 1 question and 1 follow-up from reporters on the phone in the allotted time that we have for today's briefing. We'll start with Jesse Thomas from Global. Go ahead, Jesse.
Thank you. I just wanted to start off by asking about the situation at the Halifax Infirmary. Can we get an update from public health as to what we know about that outbreak and how it's impacting patients and hospitals?
So we know there was an outbreak of, I believe, 8 cases of patients on a non-COVID ward. All of those patients have been transferred to the COVID unit and are being cared for there. There's been testing of additional patients and staff on that unit, and it's Nova Scotia Health, their infection control team, supported by Public Health, are investigating further or doing further investigation on the outbreak. But I do know that all appropriate infection control and outbreak investigation steps are being taken.
Go ahead, Jesse, with your follow-up.
Thank you. Just following up to that, I guess, what kind of danger does that pose now that we see an outbreak happen in a non-COVID unit? And will that put significant strains on the healthcare that's going on in that hospital, which is already, feeling the effects, Doctor?
So anything like this puts additional pressure. We do know that from even from wave 1, there are comprehensive programs and protocols in place for screening and now testing of patients that are being admitted to the hospital. All staff follow, whether on a COVID unit or not, follow appropriate infection control protocols and use appropriate PPE. Given the number of patients we've had come into the hospitals through this pandemic, the fact that this is now the first time we've had any kind of a patient with some spread on a unit, I think is testament to all those steps that are in place. But we need to continue to, like anywhere else, we need to continue to make sure that we're strict adherence to all the COVID protocols that are in place to minimize any risk within our hospitals.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Yes, good afternoon. I wonder if I could ask the Premier and maybe Dr. Strang to react to the court decision. I've read it. The judge was uncompromising in his stance and in his language. Judge Norton said the groups were uninformed or willfully blind to the scientific and medical evidence used to support public health restrictions. I'm just wondering your reaction to what the judge said.
Well, we're obviously pleased. We prepared for this injunction that we were approved for today in advance. We knew that there was some social media activity encouraging people to come out and willfully break the public health protocols that were put in place to keep people safe. There's no question these people don't believe in science. They don't believe in masks, vaccines. This is nothing more than an alt-right group that wants to protest things like science, and we're pleased with the decision.
Go ahead, Keith, with your follow-up.
Yes, I was wondering about Dr. Strang as well. You were actually you took part in the hearing and were a witness. Just what is it that you wanted to get across in terms of what these people were doing?
So I'm very pleased with the decision. We're in a very serious situation. We're in the middle of a global pandemic. We cannot let a small group of individuals who willfully dismiss the science, willfully dismiss the evidence around how their actions could put other people at significant risk. We cannot allow that to happen, and I'm very pleased with the judgment.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. I'm wondering if you can talk a bit about how the outbreak at the hospital started. Do we have any information about that at this point?
There's no firm conclusion on this. It's quite likely that every patient who's tested when they come in, it's quite likely that there was an individual, their first test was negative, but then if they were very early on an infection, and then they subsequently became positive and became infectious. It's an indication of how we have to have multiple layers. Testing is important, but testing alone isn't 100% effective. So all the other steps that are in the hospital are around, infection control and personal protective equipment for healthcare workers remain critically important, even while we're doing the testing.
Next, we'll go to Jean Laroche from CBC. Go ahead, Jean.
I didn't get a follow-up.
Sorry, go ahead with your follow-up, Natasha.
That's okay. Just wondering if there's been, I know you said you're still waiting for some information, obviously, about Astrazeneca and what to do with it, but is there any decision yet what Nova Scotia plans to do with the remaining less than 3,000 vials that we have in the fridge? Like, is there any consideration to making those second doses at this point, or is it still dependent on what comes out of the NACI recommendation?
Yeah, we're looking at part of our second dose planning, as well as what we're getting for the recommendations we're waiting from NACI, and how we may use the remaining Astrazeneca as part of that second dose planning.
Next, we'll go to Jean Laroche from CBC. Go ahead, Jean.
Good afternoon, gentlemen. I'm hoping, Dr. Strang, you can give us a little more on these 90 workplaces you say that are now kind of vectors for the spread of this virus. Can you give us in broad strokes, what are we talking about? I'm assuming, based on what I've seen in terms of exposure site notices, that many of them are retail operations and that sort of thing. And as a second, an addendum to that question, if you will, what powers do you have, further powers do you have to shut those places down if need be?
So first of all, the exposure notifications are used when there's been a potential exposure for the public and we can't reach everybody. Some of those may also be workplaces, but usually in a workplace we have a much greater ability to identify everybody and reach out to them individually from public health, with the cooperation of the employer, and not have to do a public notification. Those 90 workplaces are across the board. We have lots and lots of workplaces which are still allowed to operate with COVID protocols. So no surprise, this is, when we get lots of virus activity in the community, eventually there are people who are going to work, and eventually you're going to see a virus appear in workplaces. So there's no one sector or one type of workplace. It's across the board, many different types of workplaces. But what we're seeing, some of the key issues we're seeing, as I've talked about here previously, is that people are going to work when they're symptomatic. There's lots of reasons for that. Certainly having the sick pay, which was announced earlier this week, should help with that. But it's also important why employers, as part of their COVID protocol, everybody should have to go through an active daily screening where they have to basically attest to the fact that they're feeling well and they don't have symptoms. We know that many of there's been exposure in the workplaces. There's good protocols, but maybe the protocols haven't been followed very tightly. So we continue to work. Every time we have an outbreak, we certainly point out to where the breakdowns have been. We're working with our colleagues in occupational health and safety and in business who have ongoing communication with a range of workplaces workplaces to continue to communicate to them what our expectations are. All workplaces have existing COVID protocols based on work that was done a year ago on reopening. But sometimes it's reminding of them what they should be doing, and we're certainly working actively to make sure that workplace protocols in the key areas like active daily screening. Often there's breakdowns when you have people getting together in break rooms and lunch rooms, still in close contact, not masking, which is leading to lots of exposure. So we continue to work with a variety, all these workplaces around outbreaks, but also all through sectoral communications on the expectations and what's required for appropriate protocols. We're certainly looking at, continue to look at if there's a workplace that needs to be shut down to control an outbreak, we will do that. But that's usually not necessary to do.
Go ahead, Jean, with your follow-up.
I just want to follow up on my colleague's question about the injunction. I'm not quite sure why we needed to get an injunction, since there's already an order not to congregate in place, and there are already hefty fines that the police could levy but didn't the last time this group demonstrated. So if either of you gentlemen can kind of shed some light on why you felt the need for getting an injunction when we already have these mechanisms in place to enforce.
So this provides more authority for police to take action. They can, in fact, arrest and detain people. This would be a clear violation of a court order. So this gives the extra teeth. Other provinces have successfully used similar injunctions, and we're pleased with the court's decision.
Next, we'll go to Nabal Snan from the Chronicle Herald. Go ahead, Nabal.
Good afternoon. Dr. Strang, so Saskatchewan last week announced a three-step plan to gradually lift public health restrictions based on vaccination targets. So, for example, phase 1 includes reopening restaurants with a maximum of 6 people at a table 3 weeks after 70% of people aged 40 and older get their first dose. So I'm wondering if you've considered such an approach, and why or why not?
Yeah, we're aware of Saskatchewan's work. That's been discussed at the national tables that I sit at twice weekly. The general comment around the Saskatchewan plan across the country was that it's good on one side, but it doesn't accommodate at all for where you're at with the epidemiology. You have to factor both things, not just where you're at with the vaccination rate, but also where you're at with current epidemiology. So we're looking at where we starting to develop how we might slowly reopen. As I said, that the last briefing, we're basing that on the steps we took to shut down in all of our waves, what we did during wave 1 and the reopening plan. We're also working, there's lots of discussion on this at, again, the national tables and looking, talking with other provinces and territories and learning from each other about how we would do this. It's premature for us to put something on the table, then create expectations. When the epidemiology allows it, we will then move forward with a detailed reopening plan, and we're working on that. But it's far too premature for that. We need to stay focused and have Nova Scotians focused on sticking with the restrictions. We're in this at least for the next few weeks before we can even consider how we might start to reopen.
Go ahead, Nabal, with your follow-up.
Thank you for that. Dr. Strang, you said a couple of weeks ago that the province is working with long-term care on understanding the rates of staff who were vaccinated. So I'm wondering if you have any updates to share on that.
I don't have any data that's been brought back to me. I know we're still working on that and still working when there are facilities with lower than desirable vaccination rates, especially in staff. We'll continue to support those facilities, but I haven't had a roll-up of all that data brought back to me at this point.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you. Dr. Strang, I'm hearing from a number of people who are not snowbirds, and for reasons like critical family care, were out of the province when they first got a dose of COVID vaccine and have since returned home to Nova Scotia. They feel that they're falling through the cracks because they're unable to book a second dose, and public health doesn't yet know when that option will change. The Department of Health has told me it doesn't guarantee second doses within 4 months if that dose doesn't happen in the province. I'm wondering, what should these individuals expect for their second doses that do lapse? And do you expect that there will be people who have to restart and get 2 new doses?
So first of all, we recognize, and as part of our second dose planning, we are working on a plan, and we'll be able to communicate it as we start to communicate the details of second dose planning. People who were vaccinated somewhere else and now need a second dose. There's clearly evidence, and their nasty recommendation is that if someone goes longer than the preferred interval, you don't need to restart the vaccine, and you're not, you still get a very good immune response. In fact, there's growing evidence that the longer the interval between each dose of vaccine, you actually get a better immune response with the longer interval. So we will accommodate these people, and we're not putting them any risk at all by perhaps having a longer than 4 months interval between doses.
Go ahead, Lindsay, with your follow-up.
Thank you for that. I'm going to follow on a question from my colleague. In the response just now, Dr. Strang, you described some of the work on reopening plans, and I recognize it's premature to consider what reopening will look like, but I'm wondering if you can tell us more about the parameters that will be used for this planning, and what level of new daily cases would demonstrate to you that we're in a safe place for reopening.
So as I've said many times, it's not just one indicator, and we're not driven by a single number. We look at the number of the rolling 7-day average of cases. We also look at the context in which those cases are happening. What percent of them can we explain through close contact or travel versus what we call non-epidemiologic linked, which is more concerning about community spread. We look at the average number of contacts per case. So there's a lot that we always look at a number of data points, but also looking at the context. Very much, it's more what I call it's both the science but also the art of public health, taking data but also listening to my medical officer of health colleagues and their sense of just being in the middle of all case investigations, what we're seeing, and then we always have that conversation about how does that inform policy decisions, which also then have to bring in a whole range of other factors as well to make final decisions with the Premier on the steps we're going to take on reopening.
Next, we'll go to Adrien Blanc, Radio-Canada. Go ahead, Adrian.
Thank you. Premier Rankin, the Government of Canada released a life after vaccination plan today, and it says that if 75% of those eligible for vaccines have one dose and 20% have a second dose, then restrictions will start to lift, such as camping and being on patios. What do you think of this plan?
Well, that would be something we would look at together with our own recommendations here provincially. Every province looks at the epidemiology that they have locally and our own vaccine uptake. We're really impressed with the high percentages so far as we work through our own plan. People, over 80% of people are getting vaccinated that are in the higher age groups. We hope to see that with the younger age groups, and that will be well on our way to start our second doses in the late summer, but I want to make sure that we are very carefully looking at what our own local situation is before we start looking at what it looks like for a reopening that's of that scale.
And that as well. So that came out today. That is advice from the federal government. Each province has to then take that into consideration with their own local context. I believe the number is not 75% of eligible, but that's 75% of the entire population. And I think that's an important distinction. And as I said in my comments, if we're going to meet the target of 75% of the entire population that is protected, and that because that includes the less than 11 years of age and younger, and then small numbers of older people who can't get vaccinated, what we need to have is an 85% uptake of vaccine in those who are eligible for vaccine. It's important to be clear on that. So we need an 85% uptake of vaccine, and then we'll hit that federal suggested target of 75% of the entire population being vaccinated. And then all they're putting out there is really for consideration and for then adoption as appropriate by the provinces and territories. And again, it doesn't account for where we're at with our epidemiology. We always have, that's the other side of this reopening. It can't just be where we're at with vaccine. It also has to be where we're at with the disease. So while we're rolling out a vaccine program, we absolutely have to drive down our case numbers by sticking with all the public health restrictions.
Go ahead, Adrian, with your follow-up.
And so related to what you've just said, other Atlantic premiers seem pretty optimistic for an early July reopening of the bubble. what is your position on this?
Again, I've heard that as well, but it is speculative. We're still in the midst of a third wave. I remain concerned. We have high hospitalization rates right now. We need to stay focused. People really need to follow the protocols so we can get through this third wave, so we can bring our cases. I really wanted to see single digits today. We're not there yet. So I just plead for Nova Scotians to continue to work hard through the month of May as our vaccine plan continues to roll out. Then we can start thinking about what a summer looks like.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, good afternoon. Dr. Strang, I'm hoping you can give some clarification about the ICU status. There are conflicting reports on the number of people in ICU, and also can you give us kind of a profile of what's the youngest person and the median age and that sort of thing?
So, Dr. Carr, the CEO of NSH, is going to be available to the media after this briefing. He can certainly speak to much more detail on the ICU number. That does change fairly frequently. The general profile for hospitalization, we have people from 20 to 90. And everywhere in between, and the same about who ends up in the ICU across all age ranges. The key point is that the severe disease is not limited to seniors, is not limited to one group, and that there are many young, previously healthy people who are ending up very sick and ending up in the ICU. People need to understand that and need to take, if they don't have any other reason, they need to pay attention to that as to why it could be them or their family member or a coworker that could end up in this situation, and why we need everybody to take this extremely seriously.
Go ahead, Tim, with your follow-up.
Yes, I had some conversation with someone yesterday who claimed that there have been no compassionate exemptions given for end-of-life visits in terms of entering the province, and this person I'm aware of is out there casting around for truck driving jobs, hoping to get into Nova Scotia. Have you given any compassionate exemptions for end-of-life visits?
We have a whole exemption team. I don't give them personally. We've certainly have given as a significant proportion in the second and third wave of the exemptions we've given have been for compassionate for end of life situations. We've become more restrictive on that as we closed our borders down, but we still have the ability for people to apply for very specific circumstances. That if there's no other option that somebody that needs to be looked after, then they can make their case and go through the exemption process.
Next, we'll go to Chelsea Gould from the Truro News. Go ahead, Chelsea.
Hello, thank you for taking my question. Dr. Strang, of the people in hospital and ICU with COVID, most are in the central zone. Can you give us a sense of how many originate from the other zones and the type of areas they're from?
I don't have that breakdown. We know that because the bulk of our cases have been in Central Zone, that there would be people from Central Zone. But we do know that for any disease, that people with more severe illness, there's more capacity and more specialized care that's available at our tertiary care hospital. So there could be some transfer of patients involved in here as well. I don't have that exact breakdown.
Go ahead, Chelsea, with your follow-up.
Thank you. Premier, I know there's still a lot of worried people who bought a home before April 21st, and they have closing dates after May 20th. They're in limbo. So will the province consider anyone who's applying for a compassionate exemption whose closing date is after May 20th and they bought the home before April 21st?
So similar to Dr. Strang, I'm not involved in granting exemptions. We did feel like we had to have some process for those people in difficult situations to present their case for a compassionate exemption. So there is a process to be followed, and we believe we put in a fair mechanism for that, but recognizing that strict border control is an imperative piece to make sure that we're not bringing in any more cases while we're trying to control the cases that we have now.
So what we said earlier this week is that people who have a purchase up until May the 20th can apply for a compassionate exception. we've said we're not sure where we're going to be. So people who have perhaps a purchase that is that last week of May, is that do not apply at this point in time. We're not sure where we're going to end up in terms of what type of measures we'll need to have when we get into that last week of May. So we're asking people to hold off. We don't want to flood our exemption process, so people up until the 20th can apply now, and we'll make some decisions and make it clear to people who have those later closing dates as we get closer to the end of May.
Next, we'll go to Elizabeth McSheffrey from Global. Go ahead, Elizabeth.
Thank you. My question is about the new travel application process. From rotational workers in particular, they're raising concerns, that there are scenarios that would prevent them from applying to return home in a timely way. There's shift changes last minute. There's the family emergency back in Nova Scotia, and they won't necessarily have that 3 business days to turn around the approval. How is this system going to be flexible for emerging situations like that?
So people who are exempted from the full quarantine, and that includes rotational workers, don't have to do the application process. They still have to do the safe arrival, and they go through their usual process that's in place already through that safe arrival piece. Just remind folks that rotational workers coming from outbreak camp, where there's an outbreak, do have to do the full quarantine, but they're identified. They go through the usual stream through the safe arrival process for rotational workers that will identify them. So those groups that are exempted don't have to do the application process.
Go ahead with your follow-up, Elizabeth.
Sorry, I just want to make sure I'm understanding. You're saying rotational workers are not part of this new travel application process? I know some rotational workers have gotten emails saying that they are part of this process and they will have to apply to enter the province.
My understanding is, because we've got a group of workers who are mostly workers, a group of people who are we've said that they can come into the province. Permanent residents, their immediate family, people for a number of work conditions. They still have to do the safe arrival, which we've had in place for a period of time. The application process is for people who are not in those essential traveler groups, and we want to have more control, and they have to all go through the application process.
Next, we'll go to Blair Rhodes from CBC. Go ahead, Blair.
No, I'm good. All my questions were answered earlier. Thank you.
Great. Thanks, Blair. And that's all the time we have. Go ahead, Premier.
Thank you. Another weekend is upon us with tough restrictions and some nice weather, too. A good excuse to get outside and get some air, but no excuse to break restrictions. That means not gathering, staying within your own community, and following the protocols. I understand that this is hard, but I'm not going to sugarcoat this. These hospitalization rates are concerning. The potential clusters in some communities are a concern, and the fact that some people still aren't getting it is also a concern. If you don't want to follow the rules for yourself, please think of others, especially our frontline workers. This is the end of Nurses Week, and I want to thank all of our RNs, our LPNs, our nurse practitioners. You wake up every day knowing that you're putting yourself at risk to protect us, and we are grateful for your service, not just this week, but every day. It is one of the toughest professions there is, especially during a pandemic. If you are tired of COVID and don't want to follow restrictions and protocols, think of everyone like this that are making sacrifices for you. If that isn't enough, then let me remind you, these variants are still lurking in communities across the province, looking for that one person who has let their guard down, or that group that gathered, believing that they were invincible. You are taking a life-threatening risk every time that you let that guard down. So don't do it, not just for you, but for all the people around you. Have a good weekend, follow protocols, stay close to home, please.